Thank you for joining us, Delegate-elect Mark Downey. Can you tell us a bit about yourself and the district that you represent?
Dr. Mark Downey. I've been a pediatrician for the last 25 years in the Williamsburg area. Live in York County, which is part of the 69th district, which also includes parts of James City County, parts of Newport News City, and parts of Gloucester County. So kind of spread out across the peninsula there. Actually live in the house I grew up in, been in the area since age 2, uh, married, have 4 kids, and they've all gone through local schools and graduated from Bruton High School like myself. And it was kind of an honor to be able to run and represent the area that I grew up and had such fond memories of my childhood and raising my own kids. So,
And I know that you've, had a campaign for 3 times before this, and winning now. What does that represent to you? And, what do you think it signals for the people in your district?
I ran because I feel like, we need more people in medicine in the General Assembly, people that know all the changes that are happening in healthcare and education as a pediatrician, working with families, all the time regarding how they're accessing early childhood education, how they're progressing through, kindergarten, K through 12, and even getting people ready for, college and trade schools. So felt like it was kind of a natural extension of my job as a pediatrician to kind of be the voice for those that typically don't have a voice, that we can, get them the best opportunity to succeed going forward.
People's concerns have sort of shifted over the years as you've been, all that time campaigning. If you could
Yeah.
tell us a bit about that.
A combination of things. Like the first 2 times I ran were kind of, well, the first time was before the pandemic, second time was during the pandemic. And I think since then, and even now, that more and more people are concerned about, healthcare access, healthcare costs. So I think being as the only position, to be in the General Assembly, was able to lean into that to reassure them that yes, we're going to, have someone in the General Assembly that's really going to advocate for, quality healthcare access, and even in particular like the vaccines. You know, Talking to younger families with kids, of course, that was top of mind for them. But even some of the older population that grew up in the time when measles was around and polio was around, the fact that I could say, hey, I want to make sure we protect our childhood vaccine program, that resonated across all age groups, all party lines. So I think I was able to kind of reach out and reach to, a whole another block of voters that necessarily didn't I couldn't reach the first few times. So,
What are your priorities as you get ready to be in the General Assembly?
I'm hoping and anticipating to get on the Health and Human Services Committee so we can continue to work to make sure that people have access to high quality, affordable health care. Kind of preparing Virginia for changes that are coming our way from the federal government, making sure that people don't lose their insurance coverage. But also as the pediatrician, making sure we're, making sure that Virginia's still following the evidence on childhood vaccines and making sure our kids are safe in public school and staying healthy. And then hope to get on like the education committee potentially to really focus on early childhood education. My wife of 28 years is a K through 5 special education teacher, so really feel like we need to do more to make sure we have quality access to quality early childhood education as well. And then growing up along the York River and the Chesapeake Bay, would love to serve on the Ag and Agriculture and Chesapeake Bay Natural Resources Committee. So we'll see what happens. I know there are a lot of new delegates and just learning the process, but really want to make sure that you know we have the best opportunity for the foundational things that people need: good healthcare, good education, and affordable living and clean environment.
And you will be the only doctor in the House of Delegates. How do you
Yeah.
plan to really lean into that expertise? And when it comes to healthcare, what's that main issue that you're really going to be looking towards and advocating for?
Lending my expertise on how potential legislation will impact how not just the patients but how the providers are able to give the care that people need, how it impacts the communities, how it impacts the health system. I think as we navigate, healthcare in the 21st century with the advent of AI coming in, making sure we're, making policy that works for everyone and makes it more efficient, makes it more accessible, and just making sure we don't lose sight on really focusing on the evidence and facts and making good decisions, not on what's happening on social media, but what the evidence actually shows, given that expertise to really lay out how that's going to impact people.
And as we look towards the future, how will you measure success as a delegate?
Well, again, I want to make sure that, I'd love to see that every child in Virginia has, healthcare. We've made great strides, but there's still children out there that don't have healthcare, and I know plenty of adults that don't have that as well. And, kind of working our way up. If we can get all the kids covered, we have our, 65 and older covered with Medicare, and just kind of work our way into the middle, make sure everyone has healthcare. Everyone's going to have to access the healthcare system. So whatever my ultimate goal is, make sure that every Virginian has a healthcare policy and don't have to rely on, emergency room care, for their basic needs. And it's better for the patient, it's better for the Commonwealth, it's better for the health system that people are, coming in when they can have preventative health services provided and not wait until there's a crisis or a major problem. So I know it's a big lift, but I think each day that we can work to get more people covered, more people into the system is just going to benefit not only in the short term, but in the long term, benefit the Commonwealth.
Well, thank you so much for joining us today for this interview.
Well, thank you for having me, and I look forward to getting to work in January.
Thank you for watching. Make sure to subscribe to the VPM YouTube channel, hit the bell for notifications, and visit vpm.org for more in-depth coverage.